Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm talking with you tonight from Seattle. I finally have moved into an apartment. My furniture is still coming up from Austin, so it probably sounds like I'm in a big cave here. So I apologize for all that echoing going on, but I hope you can hear me okay. As usual, I'm creating a recording of tonight's webinar. So sometime tomorrow morning, probably around 9:30 to 10 a.m. Pacific Standard Time, Seattle time, you'll get an email from me announcing that recording is ready, and it will include a synopsis of what we talked about with timestamps so that you can go and see them in the video if you need to hear sections again. In terms of the way this webinar works, there's a couple ways that everyone can participate. So first of all, you can see the questions that others have asked, and I'll read those out loud as well too, and listen to the responses. There's lots of education that happens around each of these questions, and I do a lot of educating. Sometimes I talk a bit too much probably, but I think it gives you the information you need. And then the second way you could participate is to write a question. To do that question, you're going to write it down in the chat box at the bottom. Realize that when you send it, I have this set up so everybody gets it, so they can all see it too. And if you are trying to write communications between other people, it'll show up on everybody's feed. So just be aware of that. There's not a way to directly message an individual here the way that I've got this set up. All right. And so let's see. I think that pretty much handles all the business we need to do. I apologize if I sound a little snarky tonight. There was just, and I just literally got my internet services set up, and the guy brought a cat in with him on a leash. And that has unfortunately set off a little bit of allergies I've got going on here. So anyhow, there we are. All right, let's go ahead and get started here. We'll take the first question. Hello, Mary. Let's see. Hello, Dr. Ross. Thank you for all you do. You're welcome. Let's see. Hope the new office setting is going smoothly. My question is about people who have been sick a long time. Our son may be a congenital case, and by the time he was 8, he became extremely fatigued. Now 28 and very ill, history of repeated tick bites in Upper Hudson River Valley over a period of 12 years. High probability of multiple infections in him. He's never completed a good, thorough, extended protocol, though we've been to both Dr. Jones and Dr. Maas. He had deep purplish Bart stria on his back after a course of chlorithro and by accident at age 11, classic tick-borne disease and Bart symptoms of rage, extreme fatigue, bone pain, joint pain, light-sensitive brain fog, extreme POTS. Never treated for Babesia, but sure sounds like that's in the mix, extreme POTS. Question, how do you approach long-standing infections like this? Do you find that your 3 liposomal essential oils work with long-standing infections? How would you proceed? Or how would you, and I think there's a second part to the question here, hold on. Well, I'm not seeing a second part. So it is true when you have longer infection, especially if it was, from growing up and when he was younger, it is going to make it more difficult to treat. But I will say that I have success in treating this both using, I guess I got a bunch of stuff here, both using that's a cat that's on me there. Ugh, let me get that off there. So both using herbal antibiotic protocols or prescription antibiotic protocols could make a difference for your son. Either way, even with long-standing. And so you may be familiar with the odds that I have given in some of my articles, but they hold for chronic Lyme of any duration. And here's what they are. So when it comes to treating Borrelia infection, what I see is that herbal antibiotic protocols have an 85 to 90% chance they will work. And I see the same thing with prescription antibiotic protocols. And let me clarify that. Any protocol that you go on has an 85 to 90% chance of working. So for instance, if you start with Cryptolepis and Japanese knotweed for Bartonella and it doesn't work, then if you go on Hutania and Sida acuta and liposomal cinnamon clove oregano as your next choice, it also has an 85 to 90% chance of working. And I could make the same comparison for prescriptions, okay? So actually, that probably wasn't the right example, but anyhow, you get my point. So for Lyme, 85 to 90% chance of success, regardless of whether it's herbals or whether it's prescriptions, all right? For Bartonella, what I tend to see is herbally, any combination of herbs has about an 80 to 85% chance it will work, versus the prescriptions are going to be around 85%. So there may be about a 5% difference with prescription combinations over herbal combinations. And with Babesia, I think the prescription combinations tend to work about 85% of the time. And you're talking the herbs may work about 75 to 80% of the time. Okay, that's what I see in my practice. And that doesn't matter what the duration is either. Okay, now, in terms of how you decide which way you're going to go, you could always start herbal. And that's usually what I advocate, is going herbal first. The reason I advocate going herbal first is I think it's becoming more and more important to do everything we can to protect the healthy intestinal microbiome. So your intestinal microbiome is made up of bacteria that live in your intestines, viruses and parasites that live in your intestines. And the microbiome is, I would call it the brain of your body. Right? So the gut microbiome sends signals to the heart to tell it to work correctly. It interacts with the brain. It interacts with your psychiatric systems. It interacts with your immune system. It interacts with every organ of the body. And I think it's fair to say you could make an argument that the microbiome, the healthy intestinal microbiome, is the brain of everything. Okay. And I think it's becoming, as the science starts coming out more and more, I think it's important that we protect it. So I usually advocate going herbal first. And if you can't find herbal combinations that work, and the herbs have less of a problem disrupting the intestinal microbiome compared to prescriptions, all right? So I advocate going herbal first, and if they're not working, consider switching over to prescriptions, okay? Now, in terms of a timeline, how do you know something is working? And that's where it gets tricky. So with Borrelia, it takes time to turn the corner sometimes. And if we look at, there was once unpublished study done I think it was presented at the ILADS meeting about almost 20 years ago now. And it looked at how quickly do people turn the corner when you're treating them for Borrelia, just Borrelia, okay? And in the experiment, people were put on clarithromycin and metronidazole. This is before we knew about persisters. And they were watched to see how quickly they would turn around. So in that experiment, by 3 months, 30% of people started improving. By 6 months, 60% started improving. And by 9 months, 90% started improving. Okay, so it takes time, all right? So by 6 months, only 60% had seen any changes at all, okay? By comparison, if you are on a regimen for Babesia or a regimen for Bartonella that is effective, you should start seeing improvements in those Bartonella symptoms or improvements in those Babesia symptoms, usually within about 2 months or so. And if you are not, then it's time to change to a different regimen, okay? All right. I hope that gives you some things to think about there, Mary. Thank you. Good luck. Hello, Susan. Let's see. I take rifampin, 300 milligrams 2 times a day, and Tafenoquine, 100 milligrams daily for 4 days a week. All 3 B's infections, I separate them by 6 hours. Is that an appropriate dose of Tafenoquine for Babesia, Decani, Ota coli? And should I increase the Tafenoquine since I'm taking rifampin? So that's a good question. So the Tafenoquine, generally, I try to work my adults up to 300 milligrams once a week. I find that to be a more effective dose. That doesn't mean the 100 milligrams is not working for you, but if you want to know what I find to be more effective, it's usually more around 300 milligrams for an adult, okay? I am not aware of Tafenoquine and rifampin having an interaction, but let me look it up real quick. Let's see, where are we? There we are. I'm looking up in my drug interaction app here. Just a minute. Let's see, Tafenoquine. So yeah, there are no known interactions between Tafenoquine and rifampin. Now, it is true that I did say, I think last week and maybe the week before, there were some questions about rifampin and atovaquone, which is malorone interactions. And there are some there, but not with Tafenoquine. Okay, all right. And yeah, so you don't need to increase the dose of the rifampin. All right. Good luck. Oh, and in terms of, so Tafenoquine, I think, is definitely a really good idea when a person has O. coli. What I will tell you is some of the people that have been testing positive for Decani on IGeneX, we think that there may be a cross reaction where the antibodies that are being attached to the Decani proteins are really antibodies that are being made against O. coli. Okay, that may be why you stated it that way. True Decani is easier to treat than O. coli. So just be aware of that, right? All right. Hello, Eric. Let's see, hi, Dr. Ross. What do you think of Aqualaurin and their research on biofilms? And can you talk about the role of Streptococcus and Staphylococcus in chronic Lyme patients or PANS patients? Whether it's important testing, possible treatment, et cetera. Thanks for these great sessions. So yeah, we got to talk about those. So Aqualaurin is a form of Lauricidin, monolaurin Lauricidin, or monolaurin, I should say. And so it has some data that says it can break apart biofilms. I don't know that it's any better than any of the other things we advocate to take apart biofilms, but they do have data. So could it work? Yeah, it could. I haven't tried it in my practice to know the true benefit of it. I have some other things that I use. I like using lumber kinase for biofilms. I like using a product by Researched Nutritionals called BioDisrupt. The reason I like the BioDisrupt product from Researched Nutritionals is it attacks biofilms from multiple angles. The ingredients stop the stickiness of biofilms. They interfere with what's called quorum sensing, which is the ability for biofilms to communicate and grow together. They also have BioDisrupt has various enzymes in it that will help break down some of the protein and sugar components of biofilms too. In terms of monolaurin in Aqualaurin and its ability to be able to do that, all those ways, I don't know. I'd have to go back and look at the data on that. The other biofilm agent that I do like too, and this is just based on their own data too, is Biocidin. And Biocidin, like BioDisrupt from Researched Nutritionals, Biocidin also has the ability to attack biofilms from multiple angles. It will interrupt with quorum sensing, adhesion. It actually kills multiple germs that are within the biofilm too. So that's another agent that I like to use too. Okay, all right. And then in terms of staph, it's not strep that I would look at, but I would look at staph. But I usually am going to be looking at staph in somebody that has a history of developing acute psychiatric problems. So we tend to think of people that get an infection that leads to a complete psychiatric episode. That can indicate staph infection, not so much strep. In terms of somebody that had a more slow onset or didn't have a dramatic change leading to psychiatric issues, I don't think it's worth it in those situations looking for staph. I mean, it's a simple test. You want to do something called an ASO titer. And if it's elevated, that suggests you might have staph. I will let you know a number of the treatments that we do for Borrelia, particularly using amoxicillin, for instance, probably doing the Biaxins, azithromycins. Those are all going to go after staph anyhow. So it may not be that you need to specifically study for it as well, too. Okay? Yeah, so I don't think in the average person it's worth testing for it. It's more of an issue if I've got somebody that developed an acute, like they were good one day and within a few days they had a major psychiatric change. I think those are the people I would look for the staph, and I would do that with the ASO titers. Okay, all right. Hold on here, man. I'm thinking something wrong. Barry, I'm going to look something up here real quick. I'm sorry. I knew I was doing something wrong. I mean, it's strep. I wouldn't test for staph. Excuse me. I have to correct myself there. I would test. The ASO measures strep, and of the two infections, it's strep that we're worried about, not the staph that you mentioned. Okay. All right. Let me see. How do I get back here again? There we are. Got it. Hello, Nick. Let's see. Do you recommend taking breaks while on herbal tincture protocols and for methylene blue, as in take 3 months for a break for a month? Oh, as in take for 3 months and then a break for a month. So it depends on what you're treating. So when it comes to Bartonella and Babesia, I am not a big advocate of pulsing your antibiotics for any period of time. And the reason is both Babesia and Bartonella come back fairly rapidly. So we think that they replicate about every 24 hours. And so if you have only knocked your germ load down for a little bit for 3 months, but you haven't wiped the germs out, in that month that you're off, they're going to all grow back again, basically. Okay. All right. Now, Borrelia is a little bit different. Lyme Borrelia is different because it is much more slow growing. Some of us think every 4 to 8 weeks it replicates. And because it replicates so slowly, it takes a lot longer for the germs to grow back and for a person to get symptomatic. So with Borrelia, I think it's okay to take a month off here and there. I don't know you get any benefit for doing it, but I think it's okay to do it. Okay? All right. Thanks for the question, Nick. Elizabeth says, what herbs can you recommend for brucella and what herbs treat toxoplasmosis? I'm not familiar with what your herbs do. Frankly, I haven't had to address either one of those problems in 20 years of managing chronic tick-borne infections. I have not addressed those, so I don't know. I actually don't know what would be the herbal options on that. Okay, all right. Hello, Trish. Let's see. Hi, Dr. Ross. I haven't been treating for about 4 months, but the main symptom that keeps constant is vibration and shaking in the feet. It affects balance issues and sleep. I have 3 Bs. How would you treat this? This affects my whole day. It gets worse when I'm in sun, heat, and baths. Thank you, as always, Trish. All right. So there's 2 things. One is, what can you do about the symptom? And 2, what can you do about what's causing the symptom? All right. So that vibrating that you're describing and shaking in the feet and balance issues is primarily neurologic irritation. And of the 3 Bs, the one that most likely is involved in that neurologic irritation is Bartonella. So you might want to consider getting back on a Bartonella germ-killing regimen, all right? So you could do it with herbs or you could do it with prescriptions, but you might consider getting back on something that's going to bring down your Bartonella germ load. Other things that I have found helpful to calm those agitated nerves involve using something called L-theanine. L-theanine is a component of green tea, and it is converted in the brain into a chemical called GABA. And our brain nerves are full of a bunch of receptors called GABA receptors. And if you have more GABA to a GABA receptor, it calms down agitation, okay? And so by comparison, things like Lyrica and gabapentin, those all bind to GABA receptors, basically, all right? So what you want to do is L-theanine, 100 milligrams, and you could take it up to 3 times a day, and you could take it all the way up to 300 milligrams 3 times a day. Now, keep in mind, the more you take, the more sedated you might get from it, okay? The other thing that I find to be helpful is to do magnesium. And I like using magnesium glycinate because compared to magnesium malate and magnesium sulfate, the magnesium glycinate tends to have less problems with, will have a lot less chance of leading to diarrhea and loose stools. So you could do a magnesium glycinate by Researched Nutritionals, for instance, and with their formulation, 2 pills equals 250 milligrams, and you could do 250 milligrams 2 or even 3 times a day. I would start by taking it at night and see how you handle it first. Sometimes it may make you a little drowsy, and you could combine both the magnesium and the L-theanine together. Okay. All right. All right. Hey, everyone, hold on just a minute. Remember I said there was a cat in here earlier? It has really got me snotted up. I'll be right back. I just realized I have my earpieces in, so you can all hear me blowing my nose too. Sorry about that. I thought I'd stepped away from my computer and you wouldn't have to hear it. But anyhow, hopefully that's going to be a little bit better. All right, let's go on here. Bill. Hello, Bill. Let's see. Hello, Dr. Ross. I have been treating the 3 Bs on and off for 20 years. I just finished 6 months of clarithromycin, primaquine, atovaquone, methylene blue, rifampin, CCO, garlic, arterisol, and Cryptolepis. I am currently asymptomatic, however, still testing positive for all 3 on the T-Labs fish test. The LMD thinks that the Babesia is curative and would like me to stay on until I get 3 negative tests from T-Lab. Now that I am asymptomatic, I am tempted to stop treatment and see what happens. Plus, give my liver and kidneys a break. Your thoughts? On a side note, I was put on acetazolamide for treatment-resistant glaucoma to lower the intraocular pressures and found out it turns methylene blue colorless. Absolutely no blue in the toilet. Interesting. Thanks for sharing that. I think you all know that methylene blue can, which we've repurposed to manage mainly Borrelia and Bartonella for growing and persister forms. But it turns everything blue, and so everyone's constantly trying to figure out what you can do to get the blue out. I've been recommending pumice stones. One of my patients told me they learned that if you use pumice stones, you can clean out the toilet pretty easily. But that's an interesting observation on the acetazolamide as well, too. So thanks for sharing that. All right, so we get into a conversation. Your question raises a good issue, I'll call it that. And that is, what is the goal of treatment? Is the goal of treatment eradication? And part of that raises another question is, can we eradicate these germs? Can we really get rid of every germ, all right? And then so it raises those questions. And the truth is, we don't know. We don't know when we get somebody well, do we really wipe out all their germs? It is possible that what we're doing with our treatments is we're knocking the germs down to a low enough level that the immune system can step in and take care of them and keep them under control. All right. So that's just like you probably all have heard me talk about mycoplasma pneumonia, Epstein-Barr virus, and all those. And I don't advocate treating for them because what the science tells us is that in healthy people, you can find elevated antibodies against those infections. And what we think happens in those infections in healthy people is their immune system keeps them under control. And I think that Borrelia might be a similar infection, Bartonella might be a similar infection, Babesia might be a separate infection, all right? So you could argue that if you're doing well and you've been doing well for maybe 2 months, maybe 3 months, I think it's worth a trial to see, did you knock your germ load down to the level that your immune system will keep it under control, all right? Now, I will let you know, we have no studies about this. We do not know if you have a better chance of staying in remission if your T-lab test is normal for 3 tries in a row versus having the germ still there, but you feel great. We have no idea what the relapse rates are. No one's done that research. And frankly, T-labs, Dr. Mozignani and his microscope exam, this is newer. I mean, this is only about 2 or 3 years old, maybe 4 years old now. And Dr. Mozignani thinks, I just talked to him this week, he really does think that his test is very sensitive, that it can pick up all the germs that are there. And so it's a newer way of looking, and maybe with this information, maybe we will start trying to treat everyone until their microscope exams are negative. I'm not clear. That's what we need to do, though. Okay? All right. So there you go. I think it's worth a try. I don't think you're going to go backwards, or if you do go backwards, I don't think you've risked anything. You already know your roadmap to get well, and the things that got you well before should get you back there again. Okay? Good luck, Bill. Hello, Susan. Let's see. I had Bart, Babesia, and Lyme. I tested high for COVID antibodies. I got vaccinated 2 doses 3 years ago, but since then, I was never aware of having an active viral infection. Should I do anything about the high antibodies? I don't know. I would need to spend a lot more time asking a bunch of questions, and obviously we can't do it in this format. So maybe, maybe not. I don't know. Okay? All right. Good luck to you, Susan. In other words, I wouldn't just treat a high antibody. I would want to know more what's going on with you health-wise to help make a determination of that. Okay? All right. Hello, Jim. Let's see how Dr. Ross, and thanks for these great webinars. You're welcome. I've been taking methylene blue diflucan for 9 months for Bart and Borrelia, and I still haven't figured out why my urine is sometimes yellow. Boy, I haven't seen yellow urine with this combination before. Sometimes blue and sometimes a mix of the two. Also, some days my stool has a lot of blue in it, some days a little, some days no blue is visible. Is this the way it's supposed to be? If not, why might this be happening? Does it suggest any problem? I'm taking the methylene blue at 40 milligrams twice daily, and my impression was that I would be seeing a lot more blue in the urine and stool, but maybe I'm wrong about that. So what I don't know why, Jim, I'll just start by saying that. What I would say is that I see a lot of variation in all of my patients and what people report to me. Some people see a lot, some people don't. What I don't understand in you is like, where is this yellow coming from? It must be something you're eating or something you're taking that periodically interacts with your methylene blue to give that color. I'm not sure why that's happening with you exactly. Okay. All right. Good luck to you, Jim. Hello, Susan. Let's see. Thoughts on clarithromycin extended release versus regular clarithromycin for Bartonella and Lyme. So, I know the idea behind, so the extended release means it's going to stay in your system at higher doses, maybe a little bit longer. To be honest with you, in working with it, I don't see any difference in benefit between the extended release and the regular twice a day. So I see no difference in outcomes by using either one. Okay? All right. Thanks, Susan. Hello, Sandy. I tested positive for toxoplasmosis, Toxoplasma gondii. What herbal protocol would you recommend? If that doesn't work, what prescriptions would you recommend? Thank you for these webinars. So I know that, what is her name? There is one of our board members at iLads is also a physician with Ames Institute, which does a lot of brain health work. And I am just blanking on her name. She actually just got elected to be the incoming president of iLads. So I know that she believes strongly that we should be treating toxoplasma. I know she's done some webinars, and so now I know that a lot of people are thinking we need to treat toxoplasma. I'm not convinced. So toxoplasma is an infection that you can get from cats, and it can be up in the brain, but it's one of those infections kind of like Epstein-Barr virus and kind of like mycoplasma that I talk about that occurs so often in healthy people that just finding it even in a person that has tick-borne infections does not mean it became active, all right? And so that's my opinion on it. And so I don't go after it, actually. Now, I know that, oh God, what is her name? I'm so sorry, I can't remember her name. I know there is a doctor, I'm going to look her name up here just a minute. Ebony Cornish. So Dr. Ebony Cornish, I know, has been talking a bit about, I believe it's her that's been talking a bit about toxoplasma, but I'm not convinced that's what we need to be doing. So I'm not one of those people. All right. All right. Good luck to you, Sandy. Hello, Susan again. Hold on here just a minute. Let's see. For someone with the 3 active infections, should I take SPM Active while taking antibiotics to help inflammation? I have neuropathy also. Should I take ATP 360 at the same time as antibiotics? Okay. So everyone, SPM Active is a product by Metagenics. And it is basically an extract from fish oil that has components in it that are called resolvins. And resolvins, what a resolvin is supposed to do is resolve inflammation, resolve inflammation, wrap it up, okay? Where I find it to be most effective is if you've got something that has led to inflammation, but is no longer an active infection, right? By comparison, if you are still treating chronic tick-borne infections, you have something that's triggering inflammation. So it's going to be hard to resolve it without getting your germs out, right? But there are some people with long COVID where probably the infection is gone, but they still have this severe inflammation that is that keeps them ill. And so in that situation, one thing to try, especially on COVID, is to try a trial of the SPM Active to see if it can turn off this inflammation that got overly turned on in COVID, even if the COVID infection is gone. But it is not something I would advocate if you have active tick-borne infections. Now, let's say that you've gotten fairly well, you've done a germ killing and just not getting all the way there. You could make an argument in those situations that maybe you have inflammation that's just got a life of its own and you want to try to resolve it. And so then you would use resolvins in the SPM Active. That might be a situation to do it in, okay? All right, then when can you take ATP 360? You can take it anytime during treatment. You can take it while you're on antibiotics. And I have people do it either on herbal antibiotics or on prescription antibiotics. Many of you are probably familiar with ATP 360, but for those of you that are not, let me talk about it real quick. So when you have tick-borne infections and you have mold toxicity, one of the things that can happen is the immune system in dealing with these problems creates a lot of oxidizing agents. And those oxidizing agents are supposed to help kill infections, okay? But unfortunately, they can damage our fatty membranes, and specifically the phospholipid fats that make up our cell membranes and the membranes of our cell energy factories called mitochondria. And so you get oxidized phospholipids, and that renders the cells not to work as well, and especially it makes it so that the mitochondria, where cell energy is generated, it makes it so they just can't generate enough energy. What I tend to do is, and then you can assume when somebody has neuropathy, they probably have damaged mitochondria. That's a component of neuropathy. And also they have injury to the membranes that make up the nerve cells, okay? You just assume it, all right? So generally, when I'm dealing with somebody that has low energy, no neuropathy, low energy, I'm not gonna, like on the first day of treatment, put them on ATP 360, which is designed to repair that phospholipid membrane. I'm usually going to try to see if by getting them some sleep and starting to knock their germ loads down and controlling cytokines with curcumin and giving them ashwagandha for their adrenal glands, all those things that I do that are essential part of the Ross Lyme Support Protocol, I'm just going to see, does that raise their energy? That may be enough. We may not need to do any mitochondrial repair. Keep in mind, a significant factor in low energy is excessive cytokines. I think you all have heard me talk about cytokines before, but basically when white blood cells see infections, they make cytokines. Cytokines are good and bad. On the good side, they're meant to turn the immune system on to more effectively deal with an infection. But if they get made in excess, they give you all your symptoms: poor sleep, poor thinking, poor energy, aching all over, hormonal interference, etc. That's all due to cytokines, okay? All right. So my approach for people without neuropathy is to hold off on trying to repair the mitochondria until we see if just getting the germ load down makes the body feel better and energy comes up, okay? But if by around 3 to 6 months into a treatment, somebody is not responding from an energy standpoint, then I might use ATP 360, okay? All right, so what is ATP 360? Well, it's manufactured by a company called Researched Nutritionals. It's a compound that has a number of phospholipids and a number of types of phospholipids in it. In addition, it's got coenzyme Q10 in it. It has a number of micronutrients for mitochondria, and it has another component called pyroquinylene quinone, which is a compound that sparks mitochondria biogenesis, production of mitochondria, to increase the amount of mitochondria and the mass of the mitochondria, okay? And so the way you use it is 3 pills 1 time a day. And I have people take it for a minimum of 3 months before they decide if it is helping or not. If it is helping, I have them continue it for a minimum total of 6 months from when they first started using it. I also, especially when neuropathy is involved, I like to compare it with liposomal glutathione. Glutathione is a very powerful antioxidant that works from inside damaged mitochondria and damaged cells to repair damage. In fact, every one of our cells makes mitochondria, and its main role in every one of our cells is to repair things, okay? So kind of think of the ATP 360 as repairing damage to your membrane and your cell and your covering of mitochondria from the outside, and think of liposomal glutathione is doing the repair work from the inside, okay? All right, now, ATP 360 has had a number of studies done looking at it, and I think the improvements in energy of using this just for a month or two were like 50% or more. There was marked improvement in cognition when people were using this as well, too, and there were a couple other things they looked at. The liposomal glutathione product they have called Trifortify is also well studied, and the one thing that's nice about their liposomal product, liposomal glutathione, is it's absorbed. Their studies tell us that you get increased amounts of glutathione inside red blood cells. I think it's around 40 or 50% increase is a significant increase. And so when you're using glutathione, you want to make sure you're using a product that gets absorbed, and theirs does it. And also in their studies looking at glutathione, it showed marked decreased oxidation of those fat membranes, phospholipids that make up your mitochondria and your cell membranes as well too. All right? All right. Thanks for that question, Susan. Let me just do a quick screen share here. I haven't done one yet tonight. Guess I got it. Hold on here a minute. I was supposed to do some other thing here first. Do this. All right, now let's go back and try to do a screen share again. All right, so this is my Treat Lyme by Marty Ross MD site. I think many of you are familiar with it. So through here you have my Lyme guides, and then also we have my supplement store, Marty Ross MD supplements, okay? So if you're looking for these products I was talking about, they're both part of Researched Nutritionals. You can find it there. And specifically, this is the ATP 360, all right? And then the glutathione products I were talking about, that's all these products right here. There's a variety of the Tri-Fortify products, okay? All right. All right, so let's go back here. Thanks for the question, Susan. Hello, Brandy. Have you seen elevated ferritin levels before? What would cause this? Are there any natural herbs or foods to test if you have internal secondary fungal infection? I have burning skin, but not candida, no bloating or gas. All right. So ferritin is a chemical we measure. It's the storage form of iron in the body, okay? And it's sometimes, there is a condition, if you have marked elevations, there is a condition called hemochromatosis where it actually starts getting stored in the liver and can lead to health problems too. That's usually more like, I think, in the 300s or higher range, but your doctor should be able to help look at that for you, okay? Beyond being part of this condition called hemochromatosis, I am not aware of other things that cause it to be elevated, okay? The other thing would be is if you happen to be taking a lot of iron, it could be elevated for that purpose as well too, okay? And then let's see, are there any natural herbs or foods to test if you have internal secondary fungal infection? So the answer is, so I'm not aware of fungal infections coming from your foods or your herbs, okay? In fact, it would be pretty hard for them to get through the acid levels of the stomach and get lodged down in the intestinal tract. I mean, it could happen, but I'm not aware of anyone testing for those specifically. And so, yeah, I'll just say that, okay? All right, good luck, Rennie. Hello, Susan. Can liposomal cinnamon clove oregano still be taken at the same time, or be taken at the same time as antibiotics? 2, should you take both Cryptolepis and cinnamon clove oregano pill, or can you choose to take one? All right. So your herbal antibiotics and your prescription antibiotics can all be taken at the same time. So yes, the liposomal cinnamon clove oregano can be taken with prescription antibiotics at the same time. It can also be taken with prescription antibiotics and Cryptolepis and Japanese knotweed all at the same time. Okay, you can do that. I have no problem. I do that with some of my patients. I have no problem with that. All right. Now, in turn, depends on what you're using the Cryptolepis cinnamon clove oregano oil pills for. If you are using Cryptolepis, if you are treating Babesia, you probably can get by just doing Cryptolepis by itself. The clove that is in the cinnamon clove oregano has some anti-Babesia properties, but I would not call it a strong anti-Babesial agent. And so if you're just treating Babesia, do Cryptolepis by itself. If your goal is to get rid of growing and persister Lyme and growing and persister Bart, you could use either the Cryptolepis or the cinnamon clove oregano, but you get a much stronger treatment if you're putting the two together, okay? All Thanks for that question. Good luck. Hello, Susan again. Let's see, thoughts on allicin aliment products. So the allicin is a component of garlic, and it is capable of killing yeast. It may kill funguses. It can kill Borrelia. It may help break down biofilms. I haven't seen any data about whether it's useful at killing Bartonella or Babesia. I'm not clear that it does. I'm not thinking it does. But yeah, and the Alamed products, it seems to be good. Okay, so give it a try. Yeah. Let's see. Hi, Chris. Trying to follow your long COVID protocol. Have you heard of rhamnolic sulfate causing nausea or recurrence of SOV? Huh. No, I have not. Now, there is a rule of thumb I have in medicine, though. Okay. So there are the common interactions that we know about, the common side effects that might show up for like a prescription drug, would show up in our drug reference books, and on herbal antibiotics and herbs might show up in other references that we have, the common ones. Okay. But I will tell you, there are things that happen to individuals that are not common. And so what I'd like to say is, this is what my Marty Ross MD rule of medicine is, which is anything can happen to anyone with anything. All right. So we all have unique chemistries. Although we're all humans, we are all unique laboratories. All right. And it may be that you're having some kind of an odd side effect on the rhamnolic sulfate. The way to see if it is the rhamnolic sulfate is stop it for a period of time, restart it again, and see if the effects come back. And if it is bothersome enough, you may want to think about not using it. Okay? All right. Good luck, Chris. Hello, Argentina. Let's see. Have you ever treated somebody for a condition called ropeworm? In my case, apparently there is candida overgrowth that needs to be addressed first. The naturopath I have worked with prescribed Metagenics Candibactin AR for 4 to 6 weeks, followed by Candibactin BR for 4 to 6 weeks. She also said itraconazole could work synergistically with the herbs, but she could not prescribe. I want to know if you have any cases with ropeworm, as I'm looking to book an appointment with you, and I live in Washington. So Argentina, I don't believe that ropeworm is a condition that you need to treat. And let me round that out, okay? So I know there are people that take these pictures and there's these things that come out that look like rope. Studies that have been done looking at these as to whether they are true parasites or worms suggest that these are actually a bunch of mucus from the intestines, basically, that winds up in these forms. And so, and as I look at it, I don't treat it. I don't think it's a real condition to treat. I admit that you probably are seeing some things in the stool. They show up and they look like they're these things that are rope, and some practitioners will call them parasites. But when you look at the science behind it, these things are not live germs, okay? All right. And so if you don't want to come to treatment because I don't believe in it, I understand, all right? But that's my opinion on it, all right? Otherwise, if you're open to my thoughts on it and looking at what else we could do to get you well, I'd be glad to help you, okay? And regarding that, everyone, so I am supposed to sign a lease tomorrow on my new clinic space. And it's been kind of a job to get here. And I'm basically waiting on an existing tenant in a space to vacate the premises. And they haven't even been using this space for a long time. It's just sitting there empty. But my landlord has been having a hard time getting them to sign the document so that I can take the space over. But we think, as of today, that we might have a conclusion on that. And so if everything goes as planned, I should be signing a lease tomorrow. And if everything goes as planned, my intention is to start seeing people in office in Seattle the first Monday after Thanksgiving, all right? The reason I will wait that amount of time is I still have to get all the furniture put into the place. I've got to get my malpractice insurance finalized for back treating people comprehensively. I've got to get internet set up, which sometimes can take a week or two around here. So anyhow, I just need time to make sure I got it all set up before people start coming in. But so if you're wondering how you find out if I am, in fact, open, if I do sign the lease tomorrow, I plan on turning on the appointment system on Sunday to start taking full medical service visits. These are the type of visits in my practice where I can prescribe, diagnose. Okay, all right. So if you're interested, go to my scheduler or go to my appointments page on my site on Sunday. And if I did successfully execute a lease, you should be able to start booking appointments as of Sunday. All right. If not, it means I didn't successfully execute a lease tomorrow, and I'm back to developing another idea that I have. I've already been talking with another place for that. The other thing is I do intend on sending out email notification to all of my mailing list early next week announcing I am open for full business again. Okay, if I sign the lease tomorrow. So let's keep our fingers crossed. Okay, all right. Hello, John. Any experience using posaconazole, thank you, in place of other azoles with methylene blue to treat Bart? No, I haven't tried it, but you've given me a new idea. So, the azoles is a family, right? So it's made up of itraconazole, fluconazole, ketoconazole, voriconazole, and now posaconazole, and something called clotrimazole, all right? And there's other ones too. So how we all got the idea of starting to use these azoles to treat Bartonella, and I think they also help with cyst form of Lyme, is about 5 years ago now, Johns Hopkins University was doing some studies trying to figure out what do we use to kill persisters. And specifically in this one experiment, it was persister Bartonella. And what they did is they did a study where they took a member of each major antimicrobial family. So for the tetracyclines, they used doxycycline, not minocycline. For the macrolides, they used azithromycin, which is Zithromax, not Biaxin or clarithromycin, okay? And for the azoles, they used clotrimazole. Now, the clotrimazole did great in the lab on the Petri dishes and everything. It did a good job at stopping both growing and persister Bartonella. It really looks impressive. And so a number of my colleagues started trying to have it compounded so that they could have people take it. The problem with clotrimazole is it just is terribly absorbed. And even if you try to do a compound of it, it still is probably not that good absorbed, okay? So because of that, I decided, I was thinking, if the study was designed just to look at one member of the family, why wouldn't we look at, see if one member works, there's a good chance the other members of the family will too. And that's when I started using fluconazole in my practice and itraconazole. And then I started hearing reports that some of my colleagues were doing the same thing too. And I think a lot of us like the effects of it. Not everyone does. In fact, I have a lot of colleagues that are skeptical of it and haven't tried using it. And then they come and talk to me about my experience. And I think they go back and use it too. But I can't even say it, but the posaconazole, I have to look at and see if that might give me another alternative. All right. Thanks, John. So Susan says, let's see here, Tafenoquine, I take 400 milligrams a week, spread over 4 days. Is it better to take all at once on 1 day a week? That's a good question. So Tafenoquine has an extremely long half-life, meaning the amount of time that it takes to get out of your system is long. In fact, I think it may take about 2 months for it to completely get out of your system. I'm going to look that up real quick. I've looked at it before. I'm just not remembering off the top of my head right now. So Tafenoquine. Yeah, it's got a half-life of 16 and a half days, and it takes 4 half-lives for something to completely get out of your system. So it takes 2 months, or a little over 2 months, for this to get completely out of your system. So, and what that also means then is that when you have something that has a short half-life, basically it's pretty much is always in you at about the same level. And with a drug like that, even if you take 4 pills all at once on 1 day a week, that may raise your level up, but it's not going to, like, your blood level may go high, but your system level is going to stay pretty much the same level. You could maintain the system level up here high by either taking once a week, because it doesn't really get cleared out that fast, or you could spread it out over the week. I don't think it's going to make any difference, to be honest with you, all right? On the other hand, a drug like doxycycline works best by having a high peak level that goes up really high, and it cleans out of your system within an hour or two, right? So with like a doxycycline, you want to take a high level all at once and do it frequently, versus a drug that has a long half-life. You could just spread out the dosing over time. It's not going to matter. It's probably not going to have any difference of effect as compared to taking it all at once, 1 time a week. Okay? All right. Hope that made some sense. Hello, Kate. Let's see. Are herbs and supplements sufficient for treating Ehrlichia? Been treating with these for a year, and recently fingers started getting bluish, long-term pains, lone star tick mold, other systems, anorexia, tummy aches, hard to draw blood. Thank you for any help. So, as you know, I've written a couple books now about antibiotics and herbal and prescription antibiotics that can treat the various tick-borne infections. And as I looked at the data out there, I just don't see adequate data that tells me that herbal antibiotics are going to work for Ehrlichia or for Anaplasma. And those are two infections that I think it's better to go with prescriptions. Both of them, if you put somebody on doxycycline, usually within 2 to 4 weeks, you should have both Ehrlichia and Anaplasma wiped out. The alternative, if you cannot take doxycyclines or tetracyclines, is to use rifampin. And rifampin, based on the data I've seen and experience, can work quite well as well too. But those are Ehrlichia and Anaplasma are 2 infections I just don't support doing the herbal antibiotics. I don't think we have good alternatives there. Okay. Good luck, Kate. Hello, Thomas. Hello. If you are mostly symptom-free while treating the 3 Bs after a year plus and then get symptom return due to COVID, is that a sign you can't stop treating yet? No, not necessarily. I probably wouldn't stop right now, though, while you're trying to figure it out. All right, so let me try to round that out. So again, remember, when you have the 3 Bs, the reason you feel badly is too many cytokines, right? Your immune system, and trying to rid itself of these infections, releases these chemicals called cytokines. They're supposed to turn the immune system on, but the immune system doesn't do a good job, so it keeps trying harder and harder. It makes too many cytokines, and there's too many cytokines that make you feel like crap. Too many cytokines give you brain fog, give you fatigue, make you hurt all over, give you insomnia, interfere with your hormones, suppress the immune system. I mean, I can go on and on, right? Well, long COVID does the same thing. It triggers excess cytokines. And so it can take anywhere from about 2 to 4 months for all those excess cytokines in most people to go down. So I don't know how recently you got your COVID, but if you got your COVID and you're within that 4-month window or so still, I would think probably your decline is due to the cytokines from COVID. But because you can't tell for sure what's happening with your 3 Bs, you might still want to stay on those treatments until you get a little bit further out from COVID and you can get a clearer look at whether the 3 Bs might be active or not. Okay? All right. Good luck, Thomas. Let's see. Hi, Thomas again. Let's see. Also, is there a time limit on how long you recommend lumbar kinase? I've been taking for 9 months. Thank you. Sorry I can't be on the webinar, but we'll watch the recording. Tom Klein. All right. So, Tom, I'm glad you're listening to the recording now. I think that especially so lumbar kinase, there's 2 reasons to use it, everyone. And lumbar kinase, for those of you that aren't familiar, is a group of enzymes that come from the skin of earthworms. Yep, earthworms. And they're useful at breaking down a blood clotting protein called fibrin. So they're known as fibrinolytics. And what happens in tick-borne infections, fibrin can become involved in a couple different situations. So fibrin is involved in blocking treatment in Babesia and Bartonella through something that we call fibrin nest, which is the germs along with fibrin wrap themselves together in these nests, and they stick themselves on your blood vessel lining, and they basically hide from the immune system. So the immune system has a hard time seeing these infections, okay? And also your antibiotics have a harder time getting in there, okay? So that's one issue, okay? Second issue that can happen with fibrin is Bartonella and Borrelia like to grow something called biofilms. Biofilms are a mucopolysaccharide sugar slime layer that is held together in a protein skeleton made up of fibrin. All right. So one way to get rid of these biofilm coverings that also block out the immune system and block out antibiotics is to break down the protein skeleton using lumbar kinase. All right. Now, how long should you use it? Well, I think with Babesia and Bartonella, I think it's important to just stay on them until you're done. All right. If you're using it to treat Borrelia biofilm, I don't think it's as important to stay on it till the end, because at a point, I think your immune system comes down and just penetrates right through what's left of the biofilm. Okay. All right. Good luck, Thomas. All right, hold on here a minute, everyone. Hello, Tara. Let's see, or Tara. I obviously I can't tell which way you say it, but hello. We are Chris and Tara. We are here for our adult son, 38. So hello. He contracted Lyme with co-infections approximately 5 years while visiting Boston. We live here in Kitsap County, Washington. He was on a protocol from a natural doctor that practiced in Seattle. We weren't here with him at that time. His girlfriend lived with him. He seemed to get much better and was good for a few years, but then he and his girlfriend broke up, nasty breakup, and that seemed to activate his Lyme again. He also was on Adderall that his doctor gave him. He has a son, 4 years old now, and he lives in our home, and we live on the property also. He has dwindled all his retirement, gone, trying to get better again. He can't keep a job as he is very sick with all sorts of symptoms, including mental issues. He wants to work. He finally got off the Adderall and seems to be doing better mentally, but still thinks people are following him. He has a bad relationship with his ex, and he has his son 51% of the time. And again, he has, let's see, a very stressful job. My husband is disabled and we are on fixed income, so we can't financially help him too much more. We have let him live in our home and supply all his food, mostly organic whole food, and try to buy supplements when we can, along with supplying gas money, etc. We don't know a lot of what you are talking about right now, or what you are taking about right now. We need simple instructions of what to do and get for him to get well. We never ask for help, but we want him better. He wants to be better. He is also drinking ghee tea, Epsom salt baths, etc. Let's see here. So Tara, I know that this illness is complicated, right? And so I understand you may be overwhelmed by some of the things that I'm talking about here. And so, and I know your resources are limited, I get that, but sometimes it means you just need to sit down, talk with a doctor, like get him to see a physician again. And I don't know how you're going to do that with the limited resources, but if the kind of things I'm talking about are too confusing to you, then that might be the help that you need, okay? I will tell you, if you're just looking for a basic place to start, take a look at my Ross Lyme Support Protocol. And you might want to focus on the part where I talk about using 3 herbal antibiotics to treat all 3 of the Bs, Borrelia, Bartonella, and Babesia. I'll show you that here in just a second. You might want to just start by looking at that. The fact that he is having some mental health problems makes me still wonder if there is Bartonella active, because Bartonella gives you a lot of psychiatric issues, okay? So let me just show you my protocol here real quick. All right, so take a look at this tab called the Ross Protocol. All right. And in here, I talk about various things you might want to address, like things to get sleep, a healthy diet. What do you do to make sure that your bacteria doesn't get destroyed? Exercise, lowering inflammation. There's some things you can do for that. But all the way down here is where I talk about the Lyme infection. Like, what can you use for the infection? And if you scroll down here, I talk about an option 3. And this is an herbal regimen that you can use that will address all 3 germs at the same time, okay? And that is to use Cryptolepis, Japanese knotweed, and liposomal cinnamon clove oregano. That is a basic thing that you could try for him, okay? All right. So, but I would look through this whole thing. And again, if you read through it and it just seems really not understandable to you, that's when you get a physician involved. You just got to get somebody that can help you, okay? All right. Oh, and then in terms of where you get the things that you find there, you can either look up the products through my site here, or you could go directly to the place where you buy them, which is through a partnership I have with a company called Phimologist, okay? All right. Let's see here, where am I? There we are. All right. Good luck. Hello, Tracy. Hi, Marty. Have you seen or heard of any success with a series of high-dose vitamin C infusions for long COVID? How about the combination of nicotine patch and nattokinase, leberkinase? So what I would tell you is I haven't seen benefit from the high-dose vitamin C. In theory, vitamin C at really high doses, we're talking a type of vitamin C that has to be given IV. So you can do vitamin C orally, but if you start getting over anywhere from about 6,000 to 10,000 milligrams at a time, you're going to wind up getting bad diarrhea, okay? Doses, high dose vitamin C would be considered to be anything above maybe 20 to 30 grams. Some people go up to 50 grams or higher. It has to be given as an infusion. And at that level, vitamin C switches from being an antioxidant to triggering an oxidation reaction. So it's considered to be an oxidative approach, okay? Now, oxidation, in theory, should be able to kill germs by damaging their membranes. And so, in theory, it should be able to kill virus if it's still there, okay? However, we know from studies on another antioxidant or an oxidizing agent called ozone that in ozone experiments, if you take just a little bit of blood and put them in a test tube full of germs, the ozone kills nothing. And likely vitamin C would kill nothing too. So I'm skeptical that when people get vitamin C infusions for anything, if part of their long COVID is because they still have a living virus, I don't think it's going to help with that, okay? Now, the other thing it can do, though, is it can result in better oxygenation of your mitochondria. And so it could help with energy. But I advise being careful with it because at high doses, you may also be causing tissue damage. Oxidizing agents can damage cell membranes and mitochondria, right? So you might consider maybe up to 8 of them, but I wouldn't go more than that and to see if it gives a benefit. I think there's a risk of doing more than that of causing injury, okay? And then in terms of nicotine patch and the nattokinase, I know that nicotine is being advocated right now as a way of clearing the spike protein. And nattokinase, leberkinase would be useful for what are called microclots that might be part of the reason that people with long COVID don't feel well. I will tell you the science still on both of these, I think, is limited. And I do have experience with the nattokinase, leberkinase, maybe some marginal benefits. The nicotine patch idea, I haven't tried any of my patients yet. So I can't comment on it. I am interested in looking at it as I get back into clinical practice here, but I don't have the practical experience to talk about it right now. Okay? All right. Thanks, Tracy. Good luck. So Argentina, I'm just flipping over your question. So yeah, I'd be glad to see you in the office if I can help you. Okay. And again, as I said, I don't think it's probably coming from ropeworm, no. Hello, Sue. Let's see, from cyst from Lyme, do azoles or herbals work better? Also, will you continue doing weekly webinars? Your webinars are so unbelievably helpful. Yeah, I definitely will. I mean, I started doing my webinars, gosh, I think maybe 2007, 2008. I've done this. This has been a hallmark of what I have done for years. So I started doing the webinars well before I paused my clinical practice over the last few years. And so they're very much a part of what I do. So even as I get back into clinical practice, I will still be doing these webinars on Thursdays. Okay, you can count on that. Now, it's mostly weekly. As many of you know, as I've been moving back to Seattle, I kind of dropped off there for a little bit because of just traveling. But now that I've been back, I think this is the 4th one I've done in a row. I usually like to do about 3 in a row and then take a Thursday off. All right, so you will see that. So next Thursday I'm off, but yeah, you can count on me doing these. This is fun. I enjoy doing this, and I enjoy helping people too. So yeah. And then in terms of the cyst form of Lyme, do azoles or herbals work better? That's a good question. I don't know. And the thing that's interesting is when I know that. So ILAS, the International Lyme and Associated Diseases Society, came out, updated its guidelines for managing Lyme disease, gosh, maybe 5-6 years ago now. And they purport that these are evidence-based guidelines, and they are for the most part. But when you go through their data and look at the various antibiotics they recommend, the evidence behind using azoles, the science that's like Petri dish experiments and others, really doesn't exist. We think it's more of an antibiotic that we think it should work against cyst, and we see positive results. We think it works against cyst, but we don't have active science that shows it. And they even say so in their protocol. Okay, so I just want you to know that. The herbs, in terms of what we've seen with the herbal antibiotics, most of the herb experiments have mainly been done looking at growing and persisters. They haven't specifically broken out the forms of the germ. The only experiments that I have seen that somebody looked at herbal antibiotics to see do they specifically get at cyst was a group of experiments done about 12 years ago now by Eva Shoppe and her research group out of New Haven, Connecticut, or Lyme Research Group out of there. And they were specifically looking at cat's claw and otoba bark to see could they wipe out biofilms, which they did. They actually did a good job. And would they treat the various forms of the Lyme germ, including cyst? And I believe in their experiments, they showed that those two could get at the cyst, all right? So, so I just want you to know, science-based is not, we don't have the greatest science on this, all right? What do I think is stronger? I think in terms of getting effect, I think probably metronidazole, tinidazole, maybe your stronger azoles. But that's not to say that the cyst-killing effects of an otoba or a cat's claw or a Cryptolepis or a Japanese knotweed aren't pretty good too, or even a grapefruit seed extract, right? So when it comes down to it, I call it a flip of the coin. I do think maybe clinically I see stronger kills from using the azoles, but in the end, I find that all of these have a chance of getting somebody well, okay? All right. Hello, Tracy. Let's see. There was recently a sultry using nasal spray of clotrimazole for people with COVID to prevent long COVID. It was a small study, but very good results in preventing people from getting long COVID. Can you think of why it might work for that? You know, I don't know. I have to go back and look at the study, but let's just look at one thing it does. So if you spray anything up in the nose, it's going to clear out your germ load. So maybe it decreases the amount of infection that can set up by washing out some of the germs in the nose so that they don't set up shop. And so maybe some of these people get less of a COVID hit. Maybe, I don't know. I'm just postulating. I haven't even seen the study to be able to fully comment on that, but thanks for sharing that. Hello, Robinson. Good luck with signing and furnishing your new spaces. Thank you. So I will show you this. This is my home, right? There's nothing here. I'm even using beach chairs as my chair. So I do need, thank you for that. All my stuff from Austin, as I said, is supposed to be being shipped here. I think they loaded on the truck on the 5th, and then it will be here. It's in storage down there. It'll be here by the 15th or 18th. And so basically, I don't know if many of you know this, but I have a camper van. So as I've been trying to get myself established here in Seattle, rather than getting an apartment before I knew where I'd have the clinic, I kind of like to be able to keep them both together, like close by, so I can walk back and forth. So I've been living out of my camper van full time. I'm tired of living out of my camper van, by the way. But anyhow, what I have in here is everything I grabbed out of my camper van, including my 2 beach chairs, because I'm always ready to go hit a beach at any moment. So that's what I'm living out of, is stuff I pulled out of my camper van here. So believe me, it's not much. And I can tell you, I've got about as much furniture I'm going to have to get for the other space. The good thing about here is at least I have stuff that's in storage for my home. For the clinic, I've got to fully furnish the thing. So yeah, it's quite a bit. But thank you. I appreciate you saying that. Hello, Jim. Let's see. The main things I take for Bartonella and Borrelia are methylene blue and diflucan, as well as cat's claw and a small dose of herbal formulas for Bart and Borrelia based on BioDisrupt protocol. I also add the Daily Surprise, which is one of a couple of dozen substances that Bart and Borrelia don't like or that support the immune system, such as Biocidin, cordyceps, rhodiola, curcumin, glutathione, skullcap, black walnut, etc. Doing this seems to block immune overreaction and probably kill a few bugs at the same time. Do you think there are any downsides to this approach? I don't think so. I mean, the one thing, again, a point I raised earlier was with Bartonella and with Babesia, which you're not treating here, but it's the same point for both of those. Those are treatments I don't want to interrupt. I want to stay on my germ killers, some kind of germ killers, while we're doing those, because they grow back too quickly. But what you're describing here is you're on a basic level of killing antibiotics, and you're circulating in and out some other items like Biocidin that you're using or biofilms also can kill tick-borne infections too. I think you probably know that. And your black walnut and skullcap can kill as well too. So you're rotating in and out some killers, but at least you're on a basic program all the time that you're not pulsing in terms of your killers. So I don't see a downside to what you're doing. All right. Thanks, Jim. You're welcome, Tara. Hello, Susan. I seem to get a Herx reaction from taking liposomal vitamin C pills. I already am on a prescription protocol for the 3B infections for a while now. Never had such a Herx at all. Any thoughts? And do you think I should continue the vitamin C? So I don't know why you got that reaction because, again, it's high dose vitamin C, meaning the kind you would get in an IV drip that's going to kill germs. At this level, it would be antioxidant. So I'm not clear why that happened with you. Let's see. Hello, Susan, again. Let's see how to know when to keep going with a treatment that is causing Herx or when to stop. Conversely, can a treatment still be working if not causing a Herx? Good question. So in my experience, so a Herx, everyone, is immune system sees the dead bug parts and toxins and makes more of those inflammatory cytokines. And as I already described earlier tonight, it's the cytokines that make you feel sick. So in a Herx, basically you just keep feeling bad because your immune system is making cytokines, okay? And in some ways, having a Herx gives you information. If you have a Herx, it suggests you're getting killing. So in my practice, what I have found in my practice is about 85% of people during treatment for tick-borne infections will Herx. But there's about 15% that don't. And in some ways, they're the lucky ones because they don't get knocked all about by using the antibiotics. So the point I want to raise is you don't need to Herx to get better. There's about 15% of people in my experience that just don't Herx. The downside for those people is that they don't know for sure if it's working while they're still waiting to improve. All right. Second point about a Herx should be limited. So in a Herx, your system is dumping out excess cytokines. And those excess cytokines can injure you if you let it go on too long, okay? Like permanently injure you. So a Herx is something that will occur when either you start a new antibiotic or you increase the strength of the antibiotic. And for the most part, a true Herx, meaning increased cytokines from extra killing, should only last about 2 or 3 weeks. Within 2 or 3 weeks, most of the time it's going to be calmed down. If you've got something that means you feel like worse all the time and it's going on for more than a few weeks and you have not recently increased the dose of your antibiotics or you have not introduced a new antibiotic, you've got to start wondering what else is triggering excess cytokines. It may have nothing to do with the Herx. It may be that you develop too many yeast in the intestines and those yeast trigger excess cytokines, all right? It could be that your Bartonella or Babesia treatment's not working and the germs are really carrying on and triggering more cytokines. So keep that in mind. In general, a Herx should not be ongoing for months. It should only relate to timing of when you started something new that killed or you increased the dose of something and you got more killing, okay? All right. Good luck, Susan. Hello, Travis. Let's see. If nothing works for a Herx, what do you do? I've tried everything you recommend for Herxing: curcumin, ALA, NAC, glutathione, and even weekly IV glutathione is the only thing to do to decrease my herbal dose. So first of all, if you are just continually feeling bad and even the killing doesn't lighten up, make sure you look at my information about how do you diagnose too many yeast in the intestines. Just make sure there isn't something else that's triggering cytokines, okay? All right. And then secondly, yeah, if you're not getting a lightening up, as I was just suggesting with the last question, if you've got stuff that's worsening going on for a few more weeks, I think you're probably being too aggressive. Now, keep in mind, there are people that are sensitive. There are people that don't need as much in the way of dosing of antibiotics or herbal antibiotics to get an adequate kill, right? So if for some people, the goal, as you know, if you read my stuff, I say that for Bartonella and for Borrelia, a good dose of Cryptolepis is 2.5 milliliters, a half a teaspoonful 3 times a day. That's a goal, all right? That does not mean everyone's going to be able to tolerate that. In fact, some people can't. And so you find a dose that seems to move you forward. Not everyone can get to those top doses, okay? All right. Good luck, Travis. All right, everyone. I've enjoyed being with you here tonight. Let me just make sure there isn't. How do you like that? I think I got through everything. I did. Woohoo! Something's happened sometimes. So an hour and a half and we did it. Listen, everyone, it's great being with you here again tonight. Again, you all should get some email notification if, in fact, I sign a lease tomorrow and I'm back in business with helping people directly in my office. We will probably be starting to do that again the first Monday after Thanksgiving is what I'm thinking, if everything goes as planned. So I will send out an email on that. Tomorrow morning, you'll get an email early, before 10 o'clock, I hope, with a summary of what we talked about and timestamps on the video so you can watch it again. And in that email, you'll be able to sign up for the next series of webinars, which will begin in 2 weeks. So I'm going to take next week off from doing the webinars, and then the week after that, we'll be back at it again. Okay? All right. Good night, everyone.